Welcome to episode 207 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. This is the fifth and final part of a series about poison myths and misconceptions. My guests are Angel Bivens and Dr. Wendy Stephan. They're both educators at poison centers. Angel is a pharmacist from Maryland, and Wendy is an epidemiologist from Florida. In this episode, we'll cover one last topic. Then we'll do a wrap-up of the entire series. What's the last topic, you may ask? It's resources. Resources were mentioned throughout the series. We'll hear Angel and Wendy mention a few last ones. Then I'll list important resources that you'll find in the show notes so that you have a good reason to go to my website, thepharmacistvoice.com, and read them. How do you find the show notes? Go to thepharmacistvoice.com, click on the podcast tab, and then search for episode 207. Next, I need to share one last disclaimer. I've shared this disclaimer throughout the entire series. Listener discretion is advised. Some of the topics covered in this series include children putting weird things into their mouths, poisonings, injuries, and death. These are sensitive topics. If you have small children or impressionable individuals listening with you today, listener discretion is advised. Thank you. Now, without further ado, here's our brief conversation about resources. Well, ladies, as we start to wrap this up, I know you just mentioned a number of resources. The Youth Risk Behavior Survey Surveillance System, a couple S's at the end, just a couple. But anyways, that is a good reference. Of course, I'll get a link to that. Angel, you mentioned NIDA. What does that stand for?
Put me on the spot. Help me,
National Institute on Drug Abuse.
Okay.
So they do a lot of the testing. They actually look at the effect of drugs in the body. Also, SAMHSA is a great resource. So the Substance Abuse and Mental Health Agency, it's no accident that the mental health and substance use are studied together, right? They're comorbidities, we say. And so that's another really great resource. And their trainings were ones that sort of pointed out to me that recovery is not only possible, it's probable.
Yeah.
That most people recover. And that's some great news.
Absolutely. I love positive thinking. There were also some other resources that we talked about in our planning meeting. I'm just going to throw them out here. Feel free, either Angel or Wendy, to talk about these. The NIH has an herbal reference. Who would like to talk about that?
That was one I mentioned briefly. So that was through the National Center of Complementary and Alternative Medicine, NCAM. And so there's an Herbs at a Glance page there that's very useful and evidence-based. And they also say when there isn't evidence for things. And so I think that's important to know. You can try something, but it's good to know that it is not necessarily supported or how it's supported. That's one. And then another resource that we had thrown around, we didn't really talk about nursing moms, is the LACT-Med database from the National Library of Medicine. This is helpful particularly for people if they have a little bit of medical background, because sometimes you have to interpret it a little bit. But this is great for people who are nursing and to know about what medicines they can take during that period.
And back to the natural and herbal medicines, Pharmacist Letter actually has a really nice newsletter. So it's the Pharmacist Letter Natural Medicines Database. It is probably one of the more comprehensive and easy to read, like right there to the point. So highly recommend that one for pharmacists especially.
And then your local poison center is going to have information, about sort of things that are just popping up in your region. And then recently, actually, the American Association of Poison Control Centers changed their name to America's Poison Centers. And so that website is poisoncenters.org. And that's where you can kind of see an overarching view of all 55 poison centers in the United States and some of the resources available across the country.
It's also a way to connect with your local poison center because all of the member centers are listed on there. So you just figure out, because some states have more than one center. So you might not know. Wendy's state is one of those. So it's a good starting point if you're not sure how to find your local poison center. But, if you call them from a landline, typically you call 1-800-222-1222, you're going to get your local center.
And we invite you to celebrate National Poison Prevention Week, March 19th to 25th. We know a lot of pharmacists have displays or they put our materials in the bags that week. We want to get the word out so that people know that our resource is available, and we're happy to help.
Absolutely.
Yep. And even though National Poison Prevention Week is just 1 week out of the year, every day is a poison prevention day. It's an opportunity to save a life, right?
Absolutely.
Yes. Anything else to add? Any closing comments before we completely wrap this up?
Just that we're so glad to have the opportunity to speak to pharmacists. We really see ourselves as partners in safety. And whenever we have pharmacy students here at the center, I'm so glad you're here, because once they see what huge proportion of fatalities from poisoning do involve medicines and drugs, they see that they're central to this effort.
Thank you for sharing that. Angel, any final comments from you?
No, just knowing that the poison centers are just an overall general resource for the public, for healthcare professionals, for emergencies, for information. It's, we're just call. We are there for you, right, Wendy?
Exactly.
All right. Well, thank you both so much for being here on the Pharmacist Voice podcast. Again, second time for Wendy, third time for Angel. I love it. This is a great conversation. I think it will really help a lot of pharmacists. So thank you again, and you take care. All right. Great conversation. As you can probably tell, I love talking to Angel and Wendy. This series included a number of resources, so I'll mention the top 10 that I think that you should look at in the show notes. However, please be advised there are many, many more than 10 in the show notes. There are websites, social media links, individual links for Wendy and Angel on LinkedIn, links for the Florida Poison Control Centers, the Maryland Poison Control Center. So check out the show notes. Now, right now, I'm going to give you 10 reasons, in fact, to check out the show notes. Here are 10 resources that you should check out in the show notes. Number 1, the Poison Helpline, which you should program in your phone today and share with others, especially babysitters if you have young kids. Number 2, America's Poison Centers, which has information about National Poison Prevention Week, which is coming up the 19th through the 25th of March. Number 3, Safe Kids Worldwide. Number 4, Pharmacist Letter Natural Medicines Database. Number 5, the National Center for Complementary and Integrative Health. Number 6, the Youth Risk Behavior Surveillance System. Number 7, NIDA, the National Institute on Drug Abuse. Number 8, SAMHSA, the Substance Abuse and Mental Health Services Administration. Number 9, links to other podcast interviews that Wendy and Angel have had with me. So these are links to the Pharmacist Voice podcast. Number 10, this is the final one on my list, LactMed. Wendy mentioned it towards the end. It is a drugs and lactation database. Again, you'll find all those resources, all those 10 resources I just listed and more on the pharmacistvoice.com. Just click on the podcast tab and search for episode 207. Now for the recap of this series. First of all, I want to thank Angel Bivens from the Maryland Poison Center and Dr. Wendy Stephan from the Poison Control Center in Miami, Florida, for being with me for this series. It has been amazing. I truly have the easy part. I just ask questions and then I sit back and listen to the discussion. I keep it going from time to time, but hey, working with 2 poison educators who are great storytellers and passionate about what they do makes my job easy. Thank you, ladies. Angel and Wendy, thank you. Now for a brief recap of the poison myths and misconceptions topics that we discussed. Number 1, universal antidotes and poison neutralizers. Number 2, antidotes listed on product labels. Number 3, who staffs poison centers. Number 4, where poison center calls come from, the home and where else. Number 5, the age range of individuals exposed to poisons. Number 6, labels. Do you get labeled a frequent caller or a bad parent if you call a poison center too often? Number 7, child-proof containers. Are they really child-proof? Number 8, we talked about which age group poison prevention education helps most. Number 9, we talked about myth or fact. Do people really get poisoned by things that taste bad? Number 10, are poisonings always accidental? Number 11, do poison center staff stay in their own lane, or are they actually crime-fighting ninjas? Good question, right? Number 12, misconceptions about pharmaceutical-grade prescription fentanyl. Number 13, myths about opioid overdose and recovery. Number 14, myths about herbal, natural, and organic remedies. Number 15, how movies and TV shows affect our perception about poisonings. Number 16, what's really going on behind social media trends, like the Tide Pod Challenge. Number 17, which substances youth are abusing most right now. And number 18, resources. Check the show notes for that list of 18. I have each myth or misconception matched up with a corresponding fact. That's it. That's all I've got. This is the end of this series. Thank you so much for listening to my series, especially this, part 5 of my poison myths and misconceptions discussion with poison educators Angel Bivens and Dr. Wendy Stephan. Please visit thepharmacistvoice.com to read the show notes. Again, in the show notes, you'll find the Poison Helpline phone number, which is 1-800-222-1222, links to resources and websites mentioned, social media links, and much more. Thanks for listening. I hope you enjoyed this series. Wendy, this is the bonus myth. Let's talk about the cost of using the Poison Helpline. What's the cost?
All right, so it's always free. There's been some misinformation out there that we really want to counter. I think it came from TikTok. My daughter, who was a TikTok user, shared this with me. Basically saying that, poison control is now charging, you have to pay. And it really stemmed from a misunderstanding where a caller had been referred out for a complex veterinary consult. They had been calling our services for a dog. And the people on the phones, as you know, are doctors, nurses, and pharmacists, not veterinarians. There are wonderful services out there that do charge up front for veterinary exposure. So we do frequently refer folks out for those services. But it is true you have to pay for those. But you never have to pay for our services, and we don't want people to hesitate to call when they need help.
Awesome. Free. You can't beat that.
Yeah.
Absolutely. And the number one more time?
It's 1-800-222-1222.
Thanks, Wendy.